Right. Thank you, everybody, for joining us. My name is Peter Holton, and I am the Training and Engagement Officer for Glaucoma UK for Northern England. I would like to introduce Dan Calladine, who's our consultant ophthalmologist and founder of OcuPlan for this session. And for this session, we're going to be focusing on glaucoma and lifestyle factors. I'm just going to launch a quick poll in a minute to see what knowledge we have at the beginning of the session, and I'll be doing one at the end. Just bear with me a moment. I will do that. Okay, the poll should be there. Now, if you'd like to start filling that in for me, that would be great. So when you're filling in the poll, please don't forget to ask questions in the Q&A function here on Zoom. And please like any questions you like so we can answer the most popular ones, because we do tend to get a lot of questions. And if you're watching us live on a social media platform, please ask your questions in the comments and they will be fed into us to answer as well. So we've got about an hour today, and if afterwards you need some more information or support, we'll touch on how you can get that at the very end. So without further ado, I'll hand over to Dan. Thank you.
Thank you, Peter. Well, good evening, everybody. Peter, just confirm you can hear me okay, can you?
Yes, I can. I've actually just launched the poll now, so if you just wait a second or two.
Yeah, of course. Yeah, no
Right.
problem. No problem. Just give me the...
I'll give you the heads up. They're all filling it in now, which is fantastic. Thank you very much, everybody, for doing this. And sorry for the delayed start. We had some technical glitches when we were in preparation mode. Put it politely.
Just in the nick of time, though, Peter.
Absolutely. Absolutely. We're here. That's all that matters.
Yeah.
That's wonderful. I'll end the poll now and let Dan carry on.
Okay. Well, good evening, everybody. My name is Dan Calladine, so I'm a consultant ophthalmologist in the West Midlands, and I look after a lot of patients with glaucoma that I see regularly. And I also founded OcuPlan, which is our shared care platform, which we use to look after patients with glaucoma in the private sector. Okay, I'm going to share my screen now. And just confirm, Peter, you can see that okay?
Perfect. Yes.
Okay, great. Okay, so I'm going to talk about what glaucoma is today, and just some very basic principles about visual fields and tests and what glaucoma can mean in terms of driving. And then I'm just going to talk about lifestyle factors, which I think probably are often overlooked when it comes to glaucoma. It would be fair to say. I think most people focus on eye drops and lasers and surgery and various treatments and things, but I actually think that lifestyle factors are really important when it comes to the management of glaucoma. Okay, so first of all, glaucoma is three things. Okay, it's optic nerve damage, which gives rise to visual field loss, and the optic nerve damage is usually caused by high pressure. And there are lots of different types of glaucoma, but effectively, all of them have these three things, or the vast majority have these three things. But the optic nerve has a very delicate blood supply. And for many years, it wasn't actually known that high pressure causes glaucoma. And there was some theory that it was due to poor blood supply to the optic nerve. And I actually do think that the blood supply to the optic nerve is very important and is one of the key aspects of lifestyle type decisions with glaucoma. And then sometimes it's often overlooked about vitamin B12, because vitamin B12 is a very common vitamin in lots of foods. And it's not that if you're deficient in it, it's not that you're not eating enough of it, it's that you're not absorbing it. And so we're going to talk a little bit about vitamin B12 as well. So the optic nerve damage in glaucoma gives rise to specific patterns of visual field loss. And we all have about 1 million nerve fibers, which is quite a lot. And you can think of these as like fiber optic cables, taking the messages from the retina down the nerve to the brain. And you only start to lose the vision in terms of your visual field loss when you've lost about 1/3 of these nerves, so sort of 250, 300,000 nerve fibers. So they're very good at doubling up and helping preserve as much of the vision as possible. And the optic nerve damage usually starts on the top of the nerve and the bottom of the nerve. And because the diagram here, you can see the nerve fibers follow like an arcuate pattern, that if you damage the nerve at the top or the bottom, you end up with an arcuate type of visual field loss. Now, before you've lost 1/3 of your nerve from glaucoma, you'll be getting nerve damage and nerve loss, but it's not showing up on visual field tests. And we're very fortunate now to have optical coherence tomography scans of the optic nerve, which are really helpful if you've got early glaucoma before you've lost any visual fields. Because what these show is they actually show the damage starting before it affects your vision. So early detection of glaucoma with these OCT scans can actually mean that you can be treated and prevent the glaucoma even coming on. And it's often a source of ambiguity because people say, well, have I got glaucoma or have I not? And they might have normal visual fields. And according to the traditional diagnosis of glaucoma, if you've got normal visual fields, you probably don't have glaucoma. But we know now that actually we can see the glaucoma nerve damage on the OCT scans before you've actually developed visual field loss. And the nice thing about the scans, I mean, I'm sure all the patients on this call will have had an OCT scan of their optic nerves. And the nice thing about the scans is they're objective, not subjective. And what I mean by that is with the visual field test, it depends on how you're pressing the button and how you perform on the day. And that's subjective down to you as an individual performer and how the test is performed. But objective means the machine takes an image of the nerve, and usually that image is accurate. It can be tricky in certain people, and the ones where it's most tricky are people that are very short-sighted because they have quite a tilted optic nerve, and the nerve scan can be very difficult to get a picture of. And also, if you have any other problems in the eye, like macular degeneration, then it can be difficult to line up the nerve with a scanner. But certainly, if you've got early glaucoma, OCT scans are really helpful in determining the level of disease. Now, here's some visual field pictures of the sort of things that happen in glaucoma. And because, as I said to you before, the nerve gets damaged at the top or the bottom, you get these arcs of visual field loss that can focus in different areas. But they're all very typical of glaucoma. And when we look at visual field tests, it's usually quite obvious if it's glaucoma or not, because all the other causes of visual field loss give you very different patterns. So if you have a visual field defect that looks like glaucoma, there aren't many other things that can cause that. And these visual field changes, as you probably know, affect the peripheral vision. And so unless you test for them, then it's easy to miss because your brain often fills in the gaps. And your central vision often remains very good, even in quite advanced glaucoma. Now, visual field tests are a constant source of pain for my patients. They really don't enjoy doing them. And I try and reassure them that it's a computer doing the test, and that computer can't ask you questions. It can only show you lights that you can see and lights that you can't see. And it doesn't know what you can see unless it shows you something you can't see. So even if I was to do the test with normal vision, a large proportion of the lights I wouldn't see. And when patients miss the lights or feel they're missing the lights, they get quite anxious about it. But actually, what that's doing is it's trying to work out in that area of the vision what you can see and what you can't see. So the trick is to be consistent because otherwise the machine gets confused. So you only really press the button when you're sure that you see a light. And it's really important to try and keep your eyes still and not try and look for lights and to not overthink it too much. Now, if there's an area of your visual field where it's not sure if you've seen it or or you haven't, it'll go back and retest that area. So even if you think there's an area where you've been a bit, oh, should I have pressed that? Should I have not? The machine will sort of know that maybe you shouldn't have pressed it and come back and check that area again. But if you're doing that a lot, then the machine gets quite confused and the test can take longer and longer. You know, 3 to 4 minutes of concentrating is fine, but when it takes like 10 minutes, it can be quite tiresome. And when we look at the visual field test, we know as doctors how you've done, because the test gives us false positives and false negatives. And the false positives are that you've been a little bit trigger happy and trying really hard to do the test. I don't mind seeing those because it means that you're really concentrating and trying really hard to do them. And often those results are still very accurate. When we see false negatives, these are when the machine showed you a light and it really thinks you ought to have seen it. And perhaps you've clicked in the past at the side of it that you have seen a light of that intensity, and then you haven't seen it. And it's a sign that you may have lost concentration. So when we see false negatives, then we think about maybe trying to do that test again. But the take-home message from visual fields is try not to overthink them, keep your eyes still, and understand that a lot of the lights you won't see, and that's normal, even if you've got normal eyes. And depending on how bad the nerve damage is, the amount of visual field loss will vary. So we talk about early glaucoma, moderate glaucoma, and severe or advanced glaucoma. And certainly there's the category of almost like end-stage glaucoma, where you've really lost a lot of the peripheral vision. But I think I would add to this a new classification based on the OCT scans, when a patient's got high pressure and signs of progression on the optic nerve OCT scans, but normal visual fields. So we call that pre-perimetric. And the word perimetric means your peripheral vision, so pre-visual field loss glaucoma. And that's becoming an increasingly large proportion of patients as people are having more and more OCT scans at their opticians. Okay, so the key aspect of visual fields for many people is driving. And again, this creates a lot of anxiety because patients are not sure what to do with their visual field tests with driving. Now, I've tried to break down the rules here just to try and give you some general advice. So if you're less than 70 years of age, you only have to inform the DVLA if you've got visual field defects in both eyes. So if you've got a visual field defect in one eye and a normal visual field in the other eye, you don't need to inform the DVLA. If you're greater than 70, well, at the age of 70 and every 3 years thereafterwards, you get sent a form by the DVLA, and they will ask you on there if you have any eye conditions, and they'll ask you if you've got glaucoma, and you have to tick yes. And they will ask you if you've got visual field defects, and if you've just got the one eye, they're usually not too worried, and they'll review you perhaps every 3 years. If you've got visual field defects in both eyes, then they tend to see you every 1 year, but sometimes it's every 3 years. If you've got visual field defects in both eyes, no matter what your age, if these field defects are from glaucoma, you have to inform the DVLA. So even if you're 55, 60, 65, if you've got visual field defects in both eyes, you have to actively inform them. And as I said, depending on the severity, they'll review you, ask you to be reviewed every 1 or 3 years. Now, the law with regards to vision is broken down into 3 things. The first is visual acuity, and that has to be good enough so that with both eyes open, stationary, in good light, wearing the glasses if you wear glasses, you can see a number plate at 20 meters. Okay, so that's your level of visual acuity. You have to feel safe. So if you've had some double vision, or you don't feel confident driving, or you're worried about your vision, then you shouldn't drive. And then the third thing is the visual field tests. And when you do a visual field test for driving, the key difference is it's with both eyes open. So when you have a visual field test for in the opticians or at the eye hospital for glaucoma, we test each eye individually. When you have a driving visual field test, both eyes are open because you don't drive with one eye covered up. And the driving visual field test is not like the glaucoma visual field test that we do for monitoring you, it just shows you lights of a specific intensity, which are often a lot brighter than the visual field tests that we do for monitoring your glaucoma. And it's a yes or no. It's saying whether you can see a light in the area or not. And this picture here highlights the bit that they're really concerned about, which is this central vision, 20 degrees above and below and 120 on the horizontal. And that sort of roughly correlates to kind of, if you're looking ahead, like your windscreen, if you're looking in the rearview mirror, a picture of the out of the rear of the car. You're not allowed to miss anything in that area. You are allowed to miss a few things outside the area as long as it's not a significant amount. And they talk about clusters. So if you lose if you miss 3 or 4 lights in a specific area, then that's what they get worried about. But the odd sporadic miss is not so important. Now, this test is usually done by the optometrists as part of the DVLA assessment, and you're supposed to get 3 attempts to do this test. And often those 3 attempts are done on the same day to try and sort of make it efficient. But if you're not feeling great that day and there's distractions in the room, or you haven't got the right glasses with you or something, you can say, look, can I come back another day? So you can have one go and say, look, I don't feel right about this. Can I come back and book in another day? Because I've seen patients sometimes, they've been in a busy optometry store, there's lots going on around them, they've been a bit late getting there, they're feeling a bit flustered, and they've ended up doing 3 quick tests and failing it. And then actually they've come to see me in clinic and I've gone, well, I'm surprised you failed this. And we've done one in clinic and they've passed it. And I have to do a letter to the DVLA saying, look, I think at the time there were some distracting factors. So always just be aware that you do get 3 attempts at this, and you don't necessarily have to do those 3 attempts on the same day if for any reason you're a bit distracted that day. The reason that visual fields are so important for driving is that they're the major cause of accidents in terms of vision. Because generally speaking, if people have got visual problems, they don't drive too fast, they drive carefully, they tend to drive places where they know. In terms of visual acuity, well, your vision's got to be pretty blurred to not see what's going on around you in the car. And the visual acuity levels, I think, are relatively generous at the 6/12 level. But visual fields catch people out because your brain plays tricks on you. So you'll be driving along and if you've got a significant field defect, say on your right hand side, and you'll look to the right and there's nothing there, no car coming out, no pedestrian walking across, and then you look straight ahead again, unless you look back there, your brain will fill that area in as a gap. So it'll just fill it in with what it saw before, and someone could then walk out into that field defect area that you've got and you'll completely miss them. And that's why visual fields are really important when it comes to driving. Okay, so I'm going to move off now what glaucoma is and the tests that you have done, and talk about lifestyle changes and why these are important in glaucoma. And I alluded to this initially when I was talking about the optic nerve, which has got a rich but quite delicate blood supply. And the evolution of vision is paramount to our survival. The eye has a preferential blood supply from the heart through the aorta and the internal carotid artery. And the ophthalmic artery is one of the first branches and biggest branches off of that artery. And therefore, it is quite susceptible to cardiovascular disease. The central retinal artery, which supplies the retina and the photoreceptors inside the retina, is actually an end artery. So most of our arteries in our body, which supply parts of our body with blood, they kind of join up and they sort of help each other. So like even in the brain, there's like an anterior, a middle, and a posterior circulation, and they do overlap a little bit. But in the eye, in the retina, there is just one artery, and if that artery gets blocked, you lose the vision. So it's really important to think about cardiovascular risk factors. The blood supply to the optic nerve is a little bit different. It's made up of the posterior ciliary arteries, and there is a bit of a network there. But these ciliary arteries are quite fine, and again, they're susceptible to cardiovascular disease. So it's really important to control cardiovascular risk factors and maintain good nutrition. Here's a picture of the blood supply. So on the left of the screen there, you can see the central retinal artery, which goes into the optic nerve and passes up to the retina. And that doesn't really give off many branches at all to the optic nerve, which is the bit that's damaged in glaucoma. That mainly comes from the posterior ciliary arteries. And in terms of the venous drainage, well, that's very much dependent on what's called the central retinal vein. And the central retinal vein is susceptible to blood pressure, in particular, to diabetes, to high cholesterol. And so, you've got a quite delicate structure there with a blood supply, which you need to look after in terms of cardiovascular risk factors. So, general health considerations it's quite a long list, really. But all of these are relevant. So we talk about blood pressure. Ideally you want to keep that normal for your age. I mean, I picked some figures there, 130/85, which I think is probably an average for people between sort of 50 and 75, 80. If you can keep your blood pressure around that sort of level, ideally a bit lower. I mean, if you look at the textbooks, they'll say 120/80. That's not always possible for everybody. So, if it's above 130/85, you need to do something about it. In terms of your weight, in terms of your body mass index, it's good to keep that less than 25. Simple things are a low salt diet, so try not to add salt to food, because in general there just is too much salt in food. Processed foods should be avoided, really, because they're full of salt and the wrong sorts of fats. And ideally try and avoid sugars, fructose and sucrose, because again they can sort of increase your risk of weight gain and also diabetes and insulin resistance. It's good to eat good fats. I think fats have had a bad press over the years. There was kind of like a fat versus sugar debate in the 70s and 80s, and unfortunately the corporates who backed the sugar companies won, and fats were kind of perceived as a really bad thing. So you ended up getting low-fat yogurts and various low-fat foods. But all they did is replace the fats with sugars, and sugars are actually worse than fats. So good fats are great because they keep you full. Avocados, cheeses, fatty fish, eggs, nuts, these are all good fats. And in moderation, they can really help you reduce the amount of processed carbohydrates and food that you need to eat to feel full. And they're monounsaturated and they're polyunsaturated fats. So they're the sort of fats that you need to be looking to include. And you need to avoid the bad fats. So these are mainly in processed foods. These are saturated fats or trans fats, sort of like margarine. It's ironic, isn't it, that of course margarine was sort of pushed as being sort of better than butter, but it really isn't. Where possible, you need to avoid trans fats. Trans fats are sort of fats that are modified by temperature to kind of behave in a more kind of liquid sort of way. So they're often used in deep fried food in sort of like fast food chains and things. So you need to try and avoid trans fats. In terms of carbohydrates, they're not the enemy, but processed carbohydrates pretty much are really, really bad. We're not designed, I think, as a species to eat processed carbohydrates. Obviously it's hard to live life without eating carbohydrates. So brown rice, brown granary bread, and try and reduce white bread. Beans are a good source of carbohydrates. Vitamin B12, I mentioned earlier, is quite common in our diet and is an essential nutrient for the health of the optic nerve. And people with vitamin B12 deficiency get optic neuropathy, which can look very similar to glaucoma and also can make glaucoma worse. And it's not that you're not eating enough vitamin B12, it's just that in the body there's something called intrinsic factor, which is a way of absorbing vitamin B12. And if you and the only way to know if you're deficient is to have it checked at the GP. So you would normally do a full blood count and a vitamin B12 just to make sure that those are normal. And if you are vitamin B12 deficient, you can't actually catch up with diet. You have to have some injections to get yourself back on top of it. In terms of exercise, and again, I think here's something which is not well understood, or hasn't perhaps been well understood by the public, is how much exercise you have to do. And you actually don't need to do very much cardiac exercise. And in fact, if you do too much cardiac exercise, you actually makes you more hungry, and you end up eating more, and usually eating the wrong things. So exercise as a what you should really be doing is at least 10 minutes of cardio 3 times a week, and you want to be getting your pulse up to 150. Now I put 150 beats per minute. Again, this is going to vary, because as you get older, the maximum pulse rate that you can achieve with exercise goes down. But I would have thought 140, 150 beats per minute should be achievable for most people. And that can be achieved with 10 minutes of cardiac exercise, walking up hills quickly, exercise bike at home. And the key is really to get that pulse rate up. And that's what helps protect your heart. Resistance training is, I think, perhaps more important than cardiac exercise, and in many ways easier to do. Your muscles in your body atrophy as you get older. They become become fatty, so you lose your muscle fibers and they get replaced with fatty muscle fibers. And your muscles protect you as you get older. So they protect your joints, they protect your heart, they help keep your blood pressure down, they help burn energy so that when you do exercise, that you're being much more efficient. And unless you do resistance training every other day or every third day, you will lose your muscles. And once you've lost them, it's really hard to get them back. So I've got some slides coming up a minute about how to do the upper body, the lower body, and the core. And these are really simple things that can be done in the morning as part of like an exercise routine. And then I think another thing that gets often overlooked in terms of just maintaining health is not eating enough protein. Because if you want to maintain your muscles, you do actually have to eat enough protein. And I would hazard a guess that the vast majority of people on this call, and me included, probably do not eat enough protein every day, because it's quite difficult to do actually, particularly if you're busy or you're eating more carbohydrates. It's quite hard to make sure that you eat enough protein. But if you don't eat enough protein, you won't maintain your muscles. Okay, so food, easy to control, isn't it? Effectively, what only goes in your mouth is what you put in your mouth with the foods, but it's obviously not that easy to control sometimes for people. But I think I would just refer to that previous slide of trying to eat good fats, not bad fats, reducing processed carbohydrates, and making sure you eat enough protein and drinking enough water. Weight and blood pressure, I think, is probably most easily controlled by intermittent fasting. The problem with dieting is that dieting makes you hungry. So if you diet, you're pretty much hungry all the time because you eat kind of in a regular way, but not enough. And then you just feel hungry all the time. Fasting is a bit different. Okay, so fasting is more kind of just preventing your body from switching into the kind of the eating mode. And therefore, in theory, doesn't make you as hungry. You can control weight and blood pressure with exercise, but the problem is, as I said earlier, the more you exercise, the more hungry you'll get. Okay, so if you think about doing your basic amount of exercise, your cardiovascular exercise, and your resistance training, and make sure you eat enough protein and less of the processed carbohydrates, if you combine that with some intermittent fasting, then you will achieve lower blood pressure and a better BMI. And the two things together are quite harmonious. So I'm sure you've probably all read about fasting. I mean, the late Michael Mosley would talk about this quite a lot, actually, in his columns, and he will be dearly, dearly missed. But he was really onto something with this. And our bodies are so clever that they take advantage of modern lifestyles with weight gain. So when you wake up in the morning and you have breakfast, your body doesn't necessarily know, in theory, when your next meal is going to come from. So it tries to hold on to as many calories as possible. And even if you have like a cup of tea with some milk and half a slice of toast, your body will go, oh, I could have done with more than that. And it'll make you feel hungry. And then what you have eaten, it will like massively hold on to. Now, overnight when you're sleeping, your body kind of shifts from storing calories and storing food that you've eaten the previous day, and it starts to drift into kind of this like slightly fat burning stage. So when you wake up in the morning, if you don't have breakfast, you start to feel a bit anxious and a bit twitchy. So most people start to feel a little bit unwell, and that is effectively your body starting to burn fats. Okay, so it makes your body, it heats up your body temperature goes up, you feel agitated, you can feel angry, and if you kind of learn to tolerate that and just have like black coffee, black tea in the morning, lots of water, and push your breakfast back an hour, and the next day push it back 2 hours, and eventually push your breakfast back to lunchtime, then you've effectively created like a 16-hour fasting period from when you went to bed. And if you can get in the habit of doing that, it'll really help with your blood pressure. It'll help with your weight. And it's so much more efficient to let your body sort out these things than it is to try and exercise intensively. So we worked out that you'd have to exercise like for 10 hours of intensive exercise 3 to 4 times a week to lose the same amount of weight as intermittently fasting 3 to 4 times a week for a month. And it's so much easier to do the fasting than it is to do that intensive exercise. But I've coined this term, which is called fastercise, which is really difficult to not have breakfast, but it's really easy when you're distracted. Okay, so like for me this morning, I got up, went to work, and all morning was really busy. Didn't really think about eating until lunchtime because I'm used to that. But the job distracts me. So jobs are great for distracting you from that. So all you have in the morning is black coffee, loads of water in the morning, and then a nice lunch. And then you can eat what you like for lunch and for dinner. If you don't work, then planning a walk, planning some jobs and chores at home. These are the way to do it. So to appreciate it's a tricky thing to do, but actually as part of controlling your blood pressure and your cardiovascular risk factors, it's going to be really good for your body longer term. So in terms of cardiovascular exercise, running, walking, swimming, cycling, all these things are really good. If you do swim, just be aware of like tight-fitting goggles, so because they can sort of put a pressure effect on the eye, which is not good. So sort of avoid the goggles where they fit around the eyeball itself, where you sort of feel like it's sucking on the eye. And think about these sort of more mask-orientated goggles, which spread the pressure out around the orbital rim as opposed to the actual eye socket. And these are readily available online and often surprisingly cheaper than the more kind of expensive branded ones that fit around the eye. You should really avoid contact sports, so boxing, kickboxing, anything where you're putting a lot of pressure on your head, like with downward postures, should really be avoided. And you don't need to do much, 10 minutes 3 times a week to get your heart rate up to 150. Don't go straight in there and go to 150. You might have some underlying ischemia. Start gradually, and I think that's true of any exercise. Just gradually work up to that. And I think the cardiovascular should be seen really as a warm-up before doing more resistance training, which is the important thing. So resistance training, please don't laugh, but this needs to be something really simple and to do. And dumbbells are great because they're nice and easy, nice and small. You can store them in your sitting room. It's really important to stretch, so have a really good stretching routine before. Dumbbells are great for upper body, so working your chest, working your arms, your shoulders, and then lunges are very easy to do for your lower body and your leg muscles and your buttocks and your lower back. These are big, powerful muscle groups, and they're quite easy to maintain with lunges. And then planks are horrible to do when you first do them, but they're such a good way of strengthening your core. And again, this has been shown to help lower blood pressure. And strengthening your core will help protect your back, and that'll mean you're more likely to be able to exercise doing cardiac things as well. So, it's very easy to look online and find dumbbell exercises and plank exercises. And these are not, the nice thing about these sort of things is that they don't, you don't get all really hot and sweaty and have to change your clothes. You can just do this, in your pajamas and in the bedroom before you go downstairs. You don't have to get in gym kit and put trainers on and this thing. And really, it should be part of a healthy lifestyle. So just moving off exercise onto supplements. I often get asked this about supplements. So green leaf vegetables, fruits with antioxidants in, these are all good, but don't go mad or excessive with fruits. I mean, it's worth remembering that a lot of the fruitarians of this planet have ended up dying from pancreatic cancer because of the high levels of fructose in fruit, which sort of causes quite a strong insulin type response in your pancreas. So, a sensible amount of fruits and green leaf vegetables, but you don't have to just eat fruits and green leaf vegetables. With fruit, it's interesting to hear that animals eat overripe fruit to put weight on. So they don't eat fat or meat. They eat fruit that's going off, and they actively search that out before winter. So it's because of the fructose. Fructose in overripe fruit is less bound to fiber, and fructose is 6 times more calorific than glucose, which is the sort of white sugar that you put a spoon in your tea. Vitamin B12, as I said, get that checked at the GP, because unless you check it, you don't know. And then there's been quite a few studies about ginkgo biloba, which is a tree, and they extract ginkgo biloba from the leaves, and that has been shown to increase microcirculation and have some antioxidant capacity. So I recommend that to my patients, certainly those that have optic nerve damage. Okay, thank you. Any questions?
Great. Thank you, Dan. That was a fantastic presentation. We've got about 8 questions, maybe 10 creeping up. So the ones that come in beforehand, we'll go to first.
Yeah.
I'm led to believe inverted poses in yoga are to be avoided with glaucoma. Is there any exception to this? Is it possible that you could recommend a yoga teacher who specializes in glaucoma that I might contact to discuss a suitable regime, please? And the last bit of that question is, are clinical trials available for this matter, or has this been done?
I don't think clinical trials have been done, but what I would say is that there is some evidence to suggest that anything that's going to put pressure on the eye, straining in sort of downward poses, is not good. Yoga is great for your core and your core strengths and helping relax and also lower blood pressure. And I think it should be positively encouraged. Yoga, Pilates, Zumba, those sort of exercises that kind of work on your core are really good. And I think the key is to avoid like specific positions, like you don't really want your head kind of very low with all the pressure of your blood system and you're straining down on your head. There's probably like about 100 yoga positions, aren't there? And I think I would just do the ones where you don't feel too uncomfortable. But I think they're a good idea, and I certainly don't think doing yoga is going to make your glaucoma worse. If you just did the yoga, I think you are potentially at risk of injuring yourself. So you do need to think about your resistance training and your cardiac exercise, with your heart. And then if you combine that with some yoga and a good diet, I think that's probably going to be fine. I know that I've got a few of my patients who actually do yoga for over 70s. I've got a over 70s yoga instructor, and I think I would look out for yoga instructors who perhaps focus more on your age group.
Right.
They'll be more kind of akin to what you can and can't do. But I can't recommend one personally. Sorry.
Sure, no worries. Next one is, please can you comment on exercise and how helpful or harmful this can be for glaucoma and raising eye pressure? Swimming goggles appear to be a risk factor, and swimming after surgery is prohibited. What about sports such as tennis or racket sports where there is effort and pressure to hit a ball, straining and running? Pilates also.
Oh, well, that's interesting. I did cover that about the goggles earlier in the talk. Not too tightly fitting goggles and to have more of a mask, and that's just due to if you jump in or the pressure on the eyeball. I think, as I said, 10 to 15 minutes of exercise 3 to 4 times a week is a good idea. I can't see any problem with tennis, with any of these other exercises. I don't think there's enough evidence to suggest either way. And I think even if there was evidence, I think there's probably confounding factors there. Because it's really hard to control things like weight, like blood pressure, other cardiovascular risk factors. So I think all exercise, to be honest, should be encouraged. It's good for your mind, it's good for your body. You only get one life and you want to enjoy it, and you wouldn't necessarily be playing tennis unless you like playing tennis. And if playing tennis means that you concentrate a little bit more on maintaining your weight and doing some resistance training and looking after your muscles, then that's surely got to be a good thing. So I think I wouldn't really discourage any form of sport unless as I said, contact sport where the eye's being hit or kicked. So you avoid kickboxing, boxing, punching. But I think everything else probably would be okay within moderation.
Great. Okay, we've got about 18 questions and 15 minutes. So the next question is, I have Sejurans and B12 injections every 3 months. I've probably not pronounced that word properly. Normal glaucoma, a vegetarian. What else can I do to help my eyes?
I think the first one said Sjögren's, was that?
That's
Is it
it.
Sjögren's? Yes, that's dry eye, and that can cause quite a lot of problems with eye drops. So avoid preservatives in your glaucoma eye drops. And then also, do the simple things like hot compressors and preservative-free lubricants. B12 deficiency, well, you need to have injections because it's really hard to keep on top of that with diet alone. There is some evidence that sublingual B12 drops can maintain the levels, but if you're deficient, it's really hard to catch up with diet alone because I mentioned about the intrinsic factor. So you may need to have an injection of B12 into the muscle. So the GP would help with that.
Right.
When you're vegetarian, I think probably the key thing is like to maintain your protein levels and just be a little bit careful with the carbohydrate side of it. Try and avoid the more processed carbohydrates, so the white pastas, the white rice. Try and steer towards the brown pastas, brown rices. And in terms of your protein, search out things like lentils, types of cheeses in particular are going to be very good for you because they're full of good fats and protein. So I would probably, if I was vegetarian, I probably would look and say, well, how much protein am I actually getting? And you can work it out. And just to make sure that you're getting, 60, 70, 80, 90 grams of protein a day. As you get older, you need more protein per day because it's harder for your body to take that protein and make it into muscles. Okay, so when you're young, my kids can survive off hardly any protein and they'll absorb every single bit of it and it will grow into their muscles. But as you get older, you're losing your muscles. They don't want to grow. You just really need to be careful that you're getting enough protein.
Brilliant. Next one, I think it would be a quick one. Would you recommend fasting for someone who does not need to lose weight? BMI equals 19, weight 8 stone, height 5.5. I've got all the measurements there.
Oh wow, gosh! Don't we all wish we had those those statistics? I do actually think fasting is good for you. I think it helps your muscles stay lean. It may be your BMI is like that, but you might find your muscles a slightly higher proportion fat than you think. So I think fasting is a good thing. I think generally we all eat too much and we all eat too regularly, and our bodies are not designed to do that. So I think I would definitely consider fasting. You don't really if I've got those. Did you say? I think those figures. You didn't need to lose weight. I think you said a BMI of 19.
Yes.
Yeah, so that's quite low, and that's good. But actually, I'd be interested to know what your proportion of muscle to body fat is. And you're still going to be losing muscle. So I think, I generally think a little bit of fasting is good for everybody. I think it helps particularly with the risk of diabetes. There is this adage of the thin but unhealthy. So you might look thin, you might feel healthy, but actually you're still at risk of diabetes and other conditions if you're eating too much refined carbohydrates. So you
Okay.
do need to think about a bit of fasting just to reset your insulin resistance levels.
Okay, I've got two similar ones coming next. Any particular sleeping position advisable, and can you comment on the best sleeping position, particularly for patients who have low blood pressure at night?
There was this issue about sleeping face down, which is not good. So you want to be on your side or your back. So I mean, I don't know how they do this. I can't do this because I have a big nose, but people just sleep face down in the pillow. I think that's not a good idea. In terms of best position for low blood pressure, well, I guess just don't be too upright, I suppose, because your blood flow at night into the eye is going to be less if your blood pressure is lower. A hypotension is thought to be a risk factor sometimes for glaucoma progression. The only country I think in the world that treats low blood pressure is Germany, as far as I'm aware. We don't treat low blood pressure very much in the UK, but I think probably just making sure that you don't have too many pillows.
Right, excellent. Next one, I kind of don't understand it. I understood that plank raises eye pressure.
Well, I'm not sure about that, to be honest. It might do, like, transiently,
Hmm.
but then think about the long-term benefits. So even if it does a little bit in the short term, think about the long-term benefits. So the long-term benefits in controlling your cardiovascular risk factors. Okay, the eyes are relatively resistant to small fluctuations in eye pressure. I think if you've got end-stage glaucoma and your optic nerve is extremely vulnerable, and I talked about those mild, moderate, and severe categories, and also like the end stage where you've lost a significant amount of visual field. I think probably that's a small proportion of the people that maybe are on this call and in general in the country. And I think you do need to be a bit careful about things that might increase eye pressure, and therefore perhaps just be quite gradual about it. So just start with just 10 seconds, and just gradually go into things gradually. Don't just expect to be able to do it a minute of a plank, 3 minutes of a plank. Just gradually work up to it. If you have really advanced glaucoma, I think it's probably worth maybe seeing an ophthalmologist and saying, well, okay, let's have a baseline. What's my visual field? What are my pressures? How do my optic nerve looks on OCT? And then maybe introduce some of these lifestyle changes. And in an ideal world, you'd gradually introduce them, have the tests again in 3 or 4 months, see if things are looking a bit better, things are looking a bit worse. I mean, I've had patients who've got quite advanced glaucoma who I've started on ginkgo biloba and talked about lifestyle factors, and their visual field tests have got better. So
Right.
I think that, but that's only because we were fortunate to be able to monitor them very closely. And I know that can be quite difficult to do in the NHS, but it can be something you can work with your optician about. You could go to your opticians, have a sight test, have a visual field test, introduce some lifestyle changes. 2 months later, go back and have another sight test and a visual field test. And that won't cost you very much, but you'll get an idea if these are having a positive or a negative impact on your health.
Right. Excellent advice. Next one, quick one, hopefully. Why didn't you include nicotinamide?
Well, I'm sorry for not including that. Yeah, I mean, this is to do with the blood supply, isn't it? I think of the optic nerve. I probably don't know enough about that, if I'm honest. I know that it has an impact on the blood supply to the optic nerve, but I'm not familiar with those papers. If you'd like, I'm happy to look at that and reach out to that person independently.
Okay, great. The next two we can group up. Can you talk a little bit about vitamin B3 and omega-3 in diet? And what do you think about magnesium supplements for glaucoma?
In terms of omegas, they're great for the health of the ocular surface. In terms of thinking about thiamine and other B vitamins, they're not as important as vitamin B12, but they are important. What was the third one? There was omega-3,
Magnesium.
magnesium. Well, again, magnesium is relatively abundant in lots of things we eat and drink. I mean, I've got a bottle of sparkling water here, and it's got magnesium in it. I think as long as you're eating the right amount of magnesium, that's probably important. I don't think I would have excessive amounts of magnesium. I don't think that's going to be as important as looking after your cardiovascular risk factors.
Okay.
So this is the other thing about supplements, is that it's so easy, isn't it, just to take a tablet and think that's solved the problem.
Sure.
And actually, that's actually quite dangerous to think like that, because what you'd be better off doing is having a good diet with these various things in there and looking after your cardiovascular risk factors and thinking that's the way to sort this. Yeah, I think vitamin supplements probably not needed if you have a good balanced diet. But if you do struggle to get access to a balanced diet, then vitamin supplements are probably a good idea.
Right. Next one should be quick. I've been told by my hospital consultant not to drive because of my most recent field vision tests. Should I wait for the DVLA test before stopping driving?
Well, I would ask, did they do an Estimand visual field test, or was it based on the visual field tests with both eyes open? Because the thresholds for driving visual field tests are lower than the thresholds. Are higher than the thresholds for the glaucoma tests we do. So you might have a visual field test of both eyes independently and scored quite poorly. But in some of those areas, in a driving visual field test, the light would have been a lot brighter, and you may have seen it. And the eye doctor may have looked at it and gone, "Wow, you've got visual field defects in both eyes, and they're quite advanced." But actually, if you did a test with both eyes open, with the lights a bit brighter, you might pass. So I would ask, did they do a driving visual field test? I mean, it's difficult to comment exactly because it may be a very extreme case. We've all seen cases where you go, yeah, you really shouldn't be driving. But I think it's probably worth just getting a driving visual field test and just seeing how you do. And you can either do that informally or formally. So you could go to your opticians like Specsavers, for instance, and say, would it be possible to have a driving visual field test as well as my sight test? You could even, if you want to, you could inform the DVLA and say, look, I've got visual field defects in both eyes and glaucoma, and they'll send you to Specsavers to have a driving visual field test. So just going back to what I said about the difference between a driving visual field test and a glaucoma test that we do in the clinic, they are different. It's difficult to say from the driving visual, from the normal glaucoma tests, whether someone can drive or not until you've done the driving visual field test.
Right. Thank you. Right, we're coming towards the end, so I'm going to launch the end poll, and I'll ask one or two more questions when people are doing the poll. We've done really well with the questions, so that's good. So if you bear with me a moment. I'd like to thank Dan very much for his presentation and all the answers to the questions as well. So I'm just going to launch the poll, if you bear with me a moment.
So there were a few of those questions which I think, I probably just need to try and come back to you and those people on. And if they could reach
that's no problem.
it's always the way, you can't cover everything. And this is one of the great things about doing these talks. You hear about things that are obviously being talked about that you don't necessarily hear about as a physician. And I'll look at the research behind those things.
Great, thank you. Right, is the poll up for everybody? That's fantastic, excellent. So one more question. I sing in a choir 3 times a week. I'm 82. Does the extra pressure cause problems to my glaucoma?
I really think you should carry on singing in the choir. I can't see that being a problem. But what I would say to you is think about those other lifestyle factors I talked about, the exercise, the muscles, all the other things, making sure you have enough protein, doing the resistance training, and keep doing the choir singing. That I think that's really, really important. But if you're as healthy and as fit as you can be, then you can do other things, like we talked about planks, like we talked about tennis, like we talked about choir singing. It's if you make yourself the best you can be, then you can do these other things and they won't have an impact.
Excellent. That's great. So I think we'll draw to a close now. For those of you that want to make a note of our helpline number and email, and that is 01233 648170. And email is helpline@Glaucoma UK. Again, a big thanks to Dan for a fantastic presentation and all his questions. And our next digital glaucoma support groups will be on the 9th of September at 7 p.m. till 8 p.m. And that's on narrow angles and primary angle closure glaucoma with a specialist nurse from Manchester Royal Eye Hospital, Rachel Hilton. And then on the 15th of October, a different start time at 6:30 until 7:30. It's all about appointments and what to expect and ask. And this will be scenario-based, using lived experience as well. So we've done really well. Thank you very much, everybody. I hope you have a lovely evening. We welcome your feedback. Please complete the survey that follows so we can continue to improve these sessions for everyone. And again, one more final thanks to Dan and to my colleague Conchita in the background.